Good afternoon, Dr. Gullberg here. We're continuing our infectious disease series. Today we're going to talk briefly on the topic of septic arthritis. Septic arthritis is an infected joint. This is generally a bacterial infection of a joint. We see all joints possibly affected, especially the large joints, shoulders, hips, knees, but smaller joints can also be affected. These people present with a hot joint, painful joint, swollen joint with an effusion, as well as significant fever and warmth, redness, that type of thing, classic inflammatory indicators. When we do an arthrocentesis, we see a very high cell count, usually over 40 to 50,000 with a left shift, a lot of polymorphonuclear cells, and then also usually the bacteria grows in the fluid unless it's gonorrhea or something like that. A small percentage, about 10% of joints can be culture negative, but this is very unusual. Portal of entry of septic arthritis in adults is generally by direct spread through either an injection, like a steroid injection, through a bite, either a human bite or a dog or cat bite. But hematogenous spread can also be associated with endocarditis or a serious infection in another organ when bacteremia occurs and then seeding that way. Remember gonorrhea in the young adult who may be promiscuous, maybe not, but just gets unlucky and gets a gonococcal arthritis. Special culture media, Theramartin may be utilized in that setting. Gram-negative septic arthritis is associated sometimes with IV drug use, especially Pseudomonas in the sternoclavicular joint. Once we make the diagnosis, orthopedic surgery is the treatment of choice. We clean the joint out thoroughly. We place a PICC line and place the patient on 4 weeks minimum of IV antibiotics, sometimes 5 or 6. We monitor the CBC, BMP, and SED rate on a weekly basis, directed at the organism that causes the infection. Usually there's a Staph aureus, either MSSA, MRSA, or beta strep. Those are by far the most common. Staph epi generally not a problem unless it's a prosthetic joint. We'll talk on that topic at another time. Also must remember about gout and pseudogout, crystal disease that can be associated sometimes even with an infected joint. So we always do a crystal analysis on the fluid to rule out those diseases. So that's very important because sometimes acute gout can cause a high white count in the joint fluid as well as a left shift. So thank you, Dr. Gullberg, signing off. Have a good day.